My name is Morgan Norris, and I'll be doing a transfer from the bed to the chair and chair to the bed. The first step I'm going to do is to walk into the room and identify myself. My name is Morgan Norris. I'll be your nurse today. The next thing I'm going to do is going to get 2 identifiers off of his wristband, and I'm going to ask him for his last name and his first name and his date of birth. Make sure it corresponds with his wristband and also my charts. The next thing that I'm going to do is perform proper hand hygiene, and I'm going to use the antiseptic Germ-X and make sure to rub it in and let it dry. While it's drying, I'm going to tell the patient what we're doing today and explain to him why we're doing it. The reason we do transfers is to promote mobility, to make sure that he doesn't get any bed sores, skin breakdown, skin irritation, anything like that. We want his joints to be working as well as they possibly can. We do not want immobility. We do not want to give them another reason to have to be in the hospital. So we want them to keep moving back and forth. The next thing I'm going to do is ask the patient if he is willing to move to the side of the bed for me. I'm going to make sure that the bed is in the lowest position. So if he were to fall, it would not be long to fall. It wouldn't be a big fall. And I'll make sure that the rail is down. So, sir, can you get to the side of the bed for me? Now, if he were not able to get to the side of the bed for me, I would have placed my hand here underneath his shoulder and then right here on his thigh to help move him to the side of the bed. The next thing I'm going to do is make sure that I'm standing in here. Before I move him at all, I'm going to make sure he's not feeling lightheaded, he's not seeing blurry vision, he doesn't have headaches, anything like that. Are you feeling okay today, sir?
Yes.
No blurry vision?
No blurry vision.
No headaches?
No headaches.
No drowsiness? Nothing like that?
No.
Alright. So again, I'm standing in a broad stance to make sure I have balance and have a good base to where I can use my knees as well as I can to help him get up. Make sure that my feet are in line with him. Whenever he stands up, I'll make sure that my knees are in line with him. What I'm going to use to help him get up is a gait belt, and we are using a belt, but that will be our gait belt. We make sure to put it here on his waist. We don't want it on the ribs, and we don't want it on the abdomen to restrict him breathing. We do not want him to lose any type of airway. Are you still feeling okay, sir?
Yes.
You can breathe right?
Yes.
All right. Again, making sure I'm in the right position to help pick him up, to not hurt my back, to make sure that I can do what I'm supposed to be doing. I'm going to grab him right here. He's going to have his hands on my shoulder, and I'm going to rock him back and forth 3 times. All right. We're going to go to the back first.
Okay.
1, 2, 3. Are you feeling lightheaded, sir?
No.
No blurry vision?
No.
No drowsiness?
No.
All right. And we're going to pivot to the chair. All right. 1, 2, 3. All right. If he were to have gotten blurry or to feel dizziness or anything like that, drowsiness, we would have made sure to get his blood pressure, and if it had not resolved itself in 60 minutes or 60 seconds, we would have got him back in the bed and laid down, and we would have tried it later. The next thing we're going to do is get from back to the chair to the bed. And it's all the same, making sure you have the right stance, making sure your knees are in a line, making sure you have enough space to support yourself as you support him. All right? We're going to rock back again. 1, 2, 3. Any dizziness?
No.
Blurry vision?
No.
No headache?
No.
All right, and we're going to pivot back to the bed. All right, 1, 2, 3. All right. Now, the patient has not had any drowsiness, no blurry vision, no headaches. He has moved from the bed to the chair, back to the chair, chair to the bed. And we're going to take the gate valve off of them. You still feeling okay, sir?
Yes.
Breathing all right? You
Yes.
can
Mm-hmm.
breathe? Okay. We're going to get them back in the position of laying down. Can you do that,
Mm-hmm.
sir? All right. We're going to make sure we cover him up so he's comfortable. Make sure he's warm if he would prefer that. We're going to make sure that the bed rail is all the way up. Make sure that the bed is in the lowest position. And make sure that the call light is in reach if anything were to happen. Then we're going to do proper hand hygiene again. Make sure our hands are clean. And we're going to leave the room.